My name is Dr. Shirin Hund. I'm a United States board-certified internal medicine physician. My talk is about a concept that I call the biological footprint. It's an idea that I designed about how we think about health, not as something that we own and that's important only to us, but rather as an imprint of our legacy that we leave on other people in the world around us. I'd like them to examine how they view their own health and how the steps they take to impact their health actually have immeasurable impact on the society around them. It's a great question. I have this vivid memory that I wasn't planning to apply for TEDxZurich. I had just given birth 2 months ago and I saw the advertisement that this was happening. And I thought I'll just go for it, even if it's not the most polished or I didn't have the most preparation. And I have this distinct memory of asking my father to watch the baby, borrowing my mother's clothing because I didn't have any clothing that fit, and asking my mom to film me over and over again like an amateur director as I gave this very rough, unpracticed version of what I was planning to talk about. And it really struck me that this is what parenthood is, this is what working is, and this is what realizing what a priority is in your life, is that the time that I was taking away from my daughter was time that was precious because I was hoping that I could spread an important message about the work that I'm doing to the world around me. And I took that time and it was precious and it was stressful, but at the same time, I hoped that it would be meaningful. So I trained in Boston at one of the Harvard-affiliated teaching hospitals. And in medicine, I always knew that suffering is the biggest part of my job. It's the goal to alleviate suffering, even if one can't cure it. But I also remember being completely shocked at some of the suffering that I saw. I remember that a patient didn't want to stay in the hospital anymore because he had lost his grocery cart of belongings. And he was more concerned with the fate of his belongings in this shabby little grocery cart than about his life-threatening condition. This was so far out of my realm of understanding. This was so far from anything I had ever experienced that I felt truly terrible that we allow people to exist in this way. And I also felt powerless that the work that I was doing actually didn't address what was most important to him. And it was patients like this, it was stories like this that led me to the crux of my talk and my message. Even though I do feel like I'm living my dream job, in an alternate reality, I think I'd be a film director like James Cameron, because he has different passions. Like he loved underwater exploration and then he used that to create Titanic, or he loved the idea of Avatar and he used that to drive the Avatar series. And I think it would be pretty cool to focus all my time and focus on making something so visually beautiful that lasts the ages, which is not something I get to do in my current job. It's quite boring and it's quite simple. I think I read it on a blog somewhere, but what I do when I'm studying or working on a paper is I just pick the same piece of music and I put it on repeat on headphones and I just listen to that until I get the work done. It's something I'm trying to find in Switzerland because I really miss it from living in the United States, but it's a great pumpkin spice latte in the fall season.